Hello, PsyQ community, and welcome to today's webinar, Addressing Racial Bias in Healthcare. Today, we will gain perspectives from both the health delivery system and the organizational levels of care. My name is Amica Simmons-Yon, and I am from the Otsuka Field Medical Affairs team. I will serve as the moderator for this timely and much needed discussion. We are so excited that you have joined, and we look forward to learning as a community. This webinar is sponsored by Otsuka Pharmaceutical Development and Commercialization, Inc. and Lundbeck LLC, who are committed supporters of the mental health treatment community. Our speakers today are paid consultants of Otsuka Pharmaceutical Development and Commercialization, and I am also a paid employee. Just a few rules of engagement. The information provided is intended for your educational benefit only. No CME or CEU credits are offered. It is not intended as, nor is it a substitute for medical care or advice or professional diagnosis. As always, users who are seeking medical advice should consult with their physician or their other healthcare professional. While conducting this discussion, our speakers aim to provide you with information that is accurate, not misleading, and does not promote Otsuka and Lundbeck products. You may notice that all the attendees have been muted. We are recording today's event, and muting the phone lines assures the highest quality of sound. We will, however, hold a brief question and answer session at the end of the discussion. To participate, we encourage you to submit questions via the question box on the GoToWebinar panel at any time during the presentation. Without further ado, I would like to welcome the two phenomenal women who will lead us in our discussion. And it is with honor that I introduce Carla White and Kirby Williams. Carla White is a registered pharmacist and is the Associate Dean for Organizational Diversity and Inclusion at the UNC Eshelman School of Pharmacy. In her tenure, Dean White has built innovative education and program models and has crafted a sustainable institutional strategy for the university, which has also been a model for other organizations. Carla White has achieved national prominence for her work, including numerous peer-reviewed publications. She is the recipient of several media, teaching, mentoring, and leadership awards. And in the past, she served as the health team pharmacist at WRAL-TV in Raleigh, North Carolina. Kirby Williams is a board-certified psychiatric nurse practitioner in Richmond, Virginia, with over a decade of experience. As a practitioner, she also devotes her time to precepting and mentoring graduate nursing students at various universities across the country. She is an active member in the American Psychiatric Nurses Association. And Kirby is also the founder and president of the Black PMHNP Collective of Virginia. Currently, Ms. Williams practices at a community mental health center in Richmond. She is also heavily involved in advocacy and is recognized by peers and the community for her leadership. Carla and Kirby, thank you for taking the time to be with us today. So before we dive in, I want to make an important note that as a member of the PsyQ community and as a Black American, I am very proud to share that PsyQ firmly stands together against racism, bias, and all injustices. We stand behind our mission of improving mental health together. And this is compromised when we allow racism and bias to infiltrate our health system. It creates barriers to eliminate disparities and inequities. So we ask you to please continue to stand firmly with us. Know that in the continued future, PsyQ will provide topic content around diverse communities, races or ethnicities, and various other populations, which are all equally important. But in today's discussion, we will focus on Black Americans, which leads us to our talking points for today's discussion. Our speakers will describe experiences of racial bias within healthcare practice and professional training organizations. They will also discuss the impact of racial bias on the mental health care and treatment of Black Americans. And finally, our panelists will provide strategies to address organizational bias in efforts to promote mental health equity. When we talk about racial bias in America, it is an emerging research field. There is no perfect agreement on the definitions and the processes, but we do recognize that racial bias can influence important decisions, how people are treated. And it has been shown to be one of the factors contributing to health disparities in the Black community. In general, implicit bias refers to those attitudes or stereotypes that affect our understanding, our actions, and decisions in an unconscious manner. But unfortunately, it is the catalyst for organizational bias. You know, that set of ideas and beliefs influenced by society and leadership, which is it's prominent in all system levels, even within our healthcare system. Many Black Americans have experiences that have shaped how they utilize and deliver healthcare. So I wanted to turn this over to Kirby and ask this question about experience. When thinking about the trajectory from your educational training to your professional experiences, how have you personally encountered racial bias? And can you please share your experience?
Yes, of course. Thank you so much, Amica, for having me. And also thank you to the PsycU community. When I think about racial bias and experiences that have occurred over my training and also in my professional career, I can think of several different experiences. I start with thinking about like undergraduate and graduate degree programs that I was in, and that I was automatically assigned to mentors and also sometimes academic advisors who were Black. They weren't in my field of study. They weren't even in the career that I was hoping to move to or go to, but they were assigned to me just automatically. And at times I thought to myself, well, kind of what's the reason for that? Is there a reason that I'm being assigned this person? Not exactly sure, why, especially if they're in a law degree program or if they're in a communications major or something such as that. What this made me think about during that time is that maybe I'm not being afforded the opportunity to work with mentors in my same field because we don't share the same race. And as I reflect on that time when I was in school, now that's been over a decade now, it is really something I've thought about, and I think about it really would have been more powerful and impactful if those in academia who were responsible for doing the assigning, that they asked about my preference and said, would you be more interested or comfortable working with someone in your field of study? Or would you be more interested or comfortable in working with someone who has your same race? And I think that could have made a really big difference and would have gave me that feeling that made me feel kind of just uncomfortable or like I wasn't going to get a certain kind of mentorship or advising because I didn't share the race with someone who maybe had the expertise that I was going towards and looking to. And then about a decade ago, I became a Psych NP, and it's been a great experience overall. But what I did note, and some of the colleagues that I work with, some of the other Black colleagues that I work with, what we did note as well, is that we sometimes were like automatically verbally demoted when we would start at a new job, start on a new treatment team, and maybe others didn't know who we were. So some of our non-Black colleagues would automatically assume that we were nursing assistants, sometimes dietary staff, other times housekeeping staff. And I found that that would also often rub off into how patients would treat us as providers. And suggestions or even treatment recommendations that I would make or my other Black colleagues would make would be kind of brushed to the side or overlooked. But then when a non-Black colleague had that same kind of suggestion, it was accepted just quite easily. And also, as a professional and as a provider, we do have experiences where we do have some social engagement with other providers, which I really do value because it gives me an opportunity to get to meet others in the field in the same area where I work and I really do enjoy going to those. But again, I found that non-Black colleagues or other providers would ask me about, you know, they wouldn't ask me about my career or kind of what I did. They would ask me about Black music references or hip hop culture and things such as that. And that really rubbed me the wrong way, to be quite honest. It just didn't give me a great feeling. And what it's done is it made me very apprehensive, even now, about encounters or even future encounters I might have with non-Black colleagues, because it's just makes me feel like, well, that's all they're going to see me as, even though I have so much more to offer.
Thank you for sharing your experiences. And Kirby, I also commend you on your efforts to mitigate these biases, especially in your educational program, and thinking about how there are ways that others can mitigate them. But Carla, I would like to get your insight on several points, actually. Having worked across different health profession programs and even with other professional organizations, can you describe how racial bias presents on an organizational level? What are those structures that perpetuate this bias? And can you also provide an example of where organizations have done a good job with trying to minimize it?
So, Amica, you really touched on it very nicely whenever you said, sort of like, what is the root, or, what are some of the things that we should be thinking about when we're discussing implicit bias, microaggressions, whether it's stereotyping. All of these things are aspects of systemic racism. Systemic racism is rooted in everything that we care about, whether it be healthcare, education, politics, the criminal justice system. And so it's no surprise when you think about that, these are things that really impact people's quality of life. And so it's no wonder that, people are experiencing racism at the level that they're experiencing, at all these inequities in our society. And so if we really want to get to the root of the problem, we've got to start looking at our infrastructures. And so when I think about strategy development, and when we look at society and all these infrastructures that I just mentioned, you can sort of like apply that, or that translates to what is our infrastructure in our respective areas, and we need to build strategies around that to be able to mitigate it. And so at my unit, which is an academic organization, if you will, we began looking at our infrastructure and building strategies around that. And so I am in the business of students. And so when you think about admitting students, you're thinking about, the admissions process. How we're recruiting students. Are we casting a wider net? Do we have relationships with HBCUs, for example, and other organizations and programs where diverse talent might be? What are our interview questions like? Are they truly inclusive? Also thinking about our admissions committee, are they educated? Are our reviewers educated? And those are some examples that looking at infrastructure. But if we want to kind of address it from a standpoint organizationally, where a lot of people can resonate, how we hire, how we promote, how we reward, all of those things really make a difference and really tackle and start chipping away at that infrastructure.